Talking Teeth Thursday. Now, if you are new here and this is your first visit to Talking Teeth Thursday, my name is Leigh and I am an oral health coach with growingsmiles.co.uk. Now, I am just wondering, why have I lost what I'm looking for? So give me 1 second, because sometimes these little technical things just decide to confuse me, which is not hard, because Facebook has done something once again weird, but that is perfectly all right. So we will just go with it and hope for the best. Now, welcome. As I say, I'm Leigh, I'm an oral health coach with Growing Smiles UK, and we are ultimately here to help you have a healthier smile for life. Now, this evening we are going to talk something that is incredibly common. And when I told one of the other Growing Smiles team members what the topic was this evening, she said, "Oh, your favourite subject." I don't know if it's my favourite subject, but it's something that is a recurring theme that comes up so frequently in conversations with clients, with patients, with people that come through in our live chat function on the website, with people looking for dry mouth products that are going to help alleviate their symptoms and their discomfort with dry mouth related oral problems. So I just thought, why not? I did talk about dry mouth previously, and I meant to go and look it up by searching on Facebook, but I think it's a good couple of years ago. But anyway, it is incredibly common. Some people will have very mild discomfort from their mouth feeling a bit dry, to really quite significant problems and disease that can actually compromise, your health, your ability to eat properly, and that can impact your nutritional status and actually your quality of life. So our good friend who was with me last week, Jocelyn Harding, often talks about the dry cracker challenge and how many dry crackers can you eat in a minute. Now, if you do not suffer from a dry mouth, try it and see how your mouth feels, because this is how people with severe dry mouth will feel an awful lot of the time. We take saliva for granted. It is one of those things that is there. We don't give it a second thought until we don't have it. And when we don't have it, then we really, really can feel the discomfort and the unpleasant situation it puts us in. It can increase your risk of tooth decay and gum disease. You can see I have reverted back to the good old pen and paper, since I've had so many technical problems recently, so we will see how this works. But it has a range of symptoms. It can increase your risk of tooth decay, and it can increase your risk of gum disease. But I want to look at saliva first. So what are the pros about saliva? So the things that we actually don't give any consideration for. Well, saliva, as you can see from my little list, and you may need to enlarge that a little bit, it's really important for digestion. So it's important for when we eat. It lubricates our mouth, the soft tissues, our tongue, it buffers and neutralizes acids. It helps us when we're trying to taste our foods. It has a certain disinfecting and antibacterial benefit. It protects our teeth from the calcium phosphate in it, from tooth decay. It helps to buffer and regulate the bacteria that actually colonate the plaque biofilm. So when your mouth is dry, you tend to get a more thicker, more tenacious plaque sticky biofilm that sticks in your teeth, and with that can make it, when your mouth is dry, very difficult to speak as well as to chew. And it lubricates, as I say. It's got lots of things that we just don't give it enough credit for. And if you have just had your dinner, or you're about to have your dinner, actually one of the best ways of stimulating saliva is by chewing. And that's one of the reasons why often people with a dry mouth are recommended to chew sugar-free chewing gum, because that is a great way of actually chewing anything will stimulate the saliva flow. Now, that is all very well, but you need to be careful what you're chewing. So you don't want to be chewing something that is sugary all day long, because that most definitely will increase your risk of tooth decay. Now, bear with me, because I just want to make sure things are going as I want them to, and I don't want to miss any option of people not hearing me or seeing me or any of that sort of stuff, because it does happen and we know that. So right, let's talk a little bit about why it actually happens. So it can be a big problem with chemo and radiotherapy. So cancer therapies often actually will have a side effect, a very well known side effect of a dry mouth, and that can be a real problem for many people who are undergoing chemo or head and neck radiotherapy. Medication, types of medication you take, huge impact. There's autoimmune diseases that again actually can affect this. So Sjogren's disease, which also can cause dry eyes, and again can be related to other autoimmune disorders like rheumatoid arthritis. And there's other conditions that contribute to people having a dry mouth. So uncontrolled diabetes, infections, hormonal changes. So often I would come across people, postmenopausal women for instance, whose mouth is getting really dry, and the gums are becoming quite inflamed where they had never done before. So things like that can be affected by reduced salivary flow. I say it affects your taste, your chewing, your ability to swallow, your ability to speak, and it dramatically increases your chances of developing tooth decay and demineralization on the tooth surfaces, sensitivity, which we don't always remember to think about, and oral infections. So if you wear dentures, you're much more likely, if your mouth is dry, for the dentures to rub and create ulcers and trauma, and that's not much fun for anybody. So I mean, the aim is always with treating dry mouth problems is actually to try and identify the cause. So why is my mouth dry? And the first thing you want to consider is, am I dehydrated? And because dry mouth problems increase dramatically as we get older, it's one of those things that we don't necessarily always think about as our hydration levels. And it's really important to sip sugar-free liquids, best still is water just straight from the tap, regularly throughout the day, and make sure your body is hydrated, because it benefits in so many ways. It's not just your mouth. And I say often dry mouth, or xerostomia if you want to have the big term for it, is under recognised, and it's often related in serious cases that actually the salivary flow is just not up to scratch. So let's talk a little bit about saliva. I've said a little bit about our secret helper. As we're sticking to paper tonight, we are not taking any chances tonight. But you know, it can increase your risk of tooth decay, it can increase your risk of gum disease, because the plaque biofilm gets more sticky, more tenacious, it's more difficult to remove. It can certainly affect bad breath, and that's because it not only gathers on your teeth and your gums, but on the soft tissues and on the surface of your tongue. And when it breaks down on the surface of your tongue, you get what's called volatile sulfur compounds. Now, volatile sulfur compounds are what gives you bad taste and bad breath. So that's how bad breath comes into the scheme of when your mouth is dry. So you've lost all that buffering and neutralizing capacity that saliva just does automatically. Fourth, increases your risk of infections, particularly things like oral thrush, so candida type infections, and that can happen underneath the plate or underneath the denture, and that again can then make it difficult to wear dentures. And it doesn't matter what size; they don't need to be big full dentures. It can be a single tooth denture, but it can become really problematic when you don't have decent saliva flow. So as I say, big range in how dry mouth actually affects people's and impacts your health and your well-being. So you know, it can affect your dietary intake and the type of food you eat, because often people are advised to avoid spicy, salty foods when your mouth is dry. So that's when you need to be really careful, and maybe those are the things that you've always enjoyed in life, and that can be problematic. Having water or something liquid to drink with your food, there's a ream of suggestions that I can give people if they want to talk to me on a one-to-one basis about what you can try and how you can actually make eating more comfortable when your mouth is really dry. But I say it is incredibly common, much higher in older people, mainly because of a condition that we call polypharmacy. But polypharmacy doesn't only affect older people. Polypharmacy can affect younger people. So people are taking a number of different medications over a period of time, and that can actually have quite a dramatic effect. So saliva is 99% water, so hence the whole important thing about drinking plenty of water and maintaining your hydration level. Normally, normal healthy saliva flow is in the range of about half a litre to 1.5 litres. And if you look at sort of what you often think of 2 litre bottle of water you're trying to drink through a day, 1.5 litres is quite impressive coming out of our mouths. And they come from 3 major salivary glands in our mouth, plus are minor salivary glands that are found on the inside of our cheeks, our tongue, our lips, and sometimes if you roll your lip back like this and you dry it off with a tissue, within a minute you will see little bubbles of saliva coming to the surface, if you've got good healthy saliva flow, even faster than that. If not, you know, certainly first thing is increase your water intake. So as I say, moistens our soft tissues. Often people with xerostomia or dry mouth will find that it gets worse at night. And that's because when we go to sleep at night, our saliva output drops. And it drops really, really low during sleep time. So it's almost non-existent during sleep. And it's one of the reasons why, for everybody, it's so important to brush your teeth last thing at night with a fluoride toothpaste, leaving a little bit of the toothpaste on your teeth so that that works for you overnight when you've lost that buffering and neutralizing capacity of the saliva. So I say really important for everyone, but particularly if you do suffer from dry mouth. Many people who suffer from dry mouth will know that it gets worse at night time and will often have to take a glass of water to bed with them, or it wakes them at night because their mouth is so uncomfortable and they have real difficulty swallowing. And you know, this is part of the whole situation with dry mouth, that it does affect your taste, it can affect your ability to swallow properly, and it gives you that sort of really horrible dry sticky feeling in your mouth, and it is really, really distressing. And the reason why I wanted to revisit it this week, I have talked a lot about dry mouth to people this week. It just seems to be, is the weather getting warmer, that we're not upping our fluid intake. Really important. I always remind people, as the weather gets warmer, we get warmer, we sweat more or glow if you're ladies, and we need to make sure we're taking in enough water to maintain our hydration levels. Now, other things that relate, it's not just dehydration, other things that actually impact our dry mouth situation are medications. Now, there are loads of medication and they're not all prescribed. You may be buying medications over the counter. So even something simple like allergy medication, so stuff for hay fever, which again, it's that time of the year that you're taking hay fever medication, which is there to dry you up, to stop your runny nose. And anyone that knows me with my clinical hat on knows that at the minute, clinically, if I'm working with aerosols, I'm wearing a huge great big hood like you'll see in intensive care in hospitals at the minute. And your worst nightmare is having a runny nose. So what I take the day, whatever clinical days I am working, I will take a decongestant or an antihistamine before I go out to make sure I stay dry. And the other opposite side of that is we can't sip water during the day, which we would have done previously. So between patients, you could actually get a glass of water. You know, your hood's on, you're there, and you're stuck inside of this thing that is pumping air into you, which is brilliant because everybody feels safe and protected. But there's no doubt about it. And my throat's dry, my nose is dry, and again, I am just chugging the water as soon as I can get the thing off. So lots of reasons that your mouth gets dry. So medications, both over the counter and prescription medications, all sorts of types of medication. Sometimes it may be an option to substitute depending on how severe your dry mouth is. So it's always worthwhile talking to your doctor about, my mouth is really severe, is there an alternative that maybe doesn't have as bad dry mouth side effects? So that is worth noting and worth having that conversation. It's the other thing that sometimes can help is, can you take medication during the day rather than last thing at night, because that can lessen the symptoms of being so dry overnight? And or can you take it in a divided dose, so rather taking one larger dose, can you take it over, you know, in half doses through the day to actually reduce the impact of the dry mouth adverse effects of it all? So again, conversation with your doctor, but look at the little piece of paper that comes inside your medication and see, is dry mouth a side effect? And if you're taking a number of medications, have you a number of medications that all have a dry mouth side effect? So, pardon me, it is worth actually having a good look and saying, oh right, well, I've got 3 or 4 medications, all actually contribute to dry mouth, so well, it makes sense that I have dry mouth. So then it's a dose of what to actually do about it. If your mouth is dry, you're suffering from xerostomia because you're having cancer therapy, whether it be chemo or radiotherapy. Sometimes that can be an acute dry mouth thing, and it can be quite short-lived from the point of view of once your treatment is over, it generally can subside. On the other side, some people end up with chronic dry mouth, and it depends on the type of treatment, it depends on where your treatment has been aimed. So if you've had head and neck radiotherapy, for instance, and your salivary glands, which are here, and here, your major ones, have been in the firing line, and they will do, your oncology team will do everything they can to reduce the dose to that, because they know the severe consequences of dry mouth. But if you know, that can be a long-term and in some cases permanent thing that you have to manage dry mouth long term. Other things that can be related to dry mouth, there's certainly some research that suggests about side effects of dry mouth with certain types of recreational drug use, and things like alcohol use and tobacco use, because those also they're drugs of one form or another, but they also can have a big impact on dry mouth. So as I say, worth considering that, you know, some people who have maybe been out, had a few drinks, it's one I used to talk about a lot to students when I was talking about dry mouth and how to manage it, was, you know, to try to get them to visualize and understand how a dry mouth actually felt. So I used to say, you know, you can imagine if you've had a few drinks and you haven't bothered brushing your teeth, and you're waking up the next morning and your mouth feels sticky and dry and sort of rough and furry. Well, you know, imagine your mouth like that all the time. So alcohol is a recognised problem, particularly excessive alcohol, because alcohol has a very drying effect. And again, it's one of those things that you know, about drinking water before you go to bed if you've had a few drinks, because it's rehydrating, because the alcohol has dehydrated your body. Tobacco, again, another one that is known to actually have an impact and make your mouth much drier. So, you know, same things that we're always saying: don't drink alcohol in excess, quit smoking or quit tobacco use, because it's good for you in a lot of reasons. Make sure you're drinking plenty of water, and you know, liquid wise, make sure it's sugar free. If it's not water, look at some of the other things. Reduce your caffeine in your tea intake, anything, you know, coffee and tea, anything that is caffeine in it. But you know, there's plenty now of decaffeinated teas, decaffeinated coffee, so you don't need to deprive yourself of your coffee taste just to reduce your caffeine intake. So those are all points that are worth considering. Coming back to aging and saliva and our saliva flow. Dry mouth affects about 30% of people over 65 years of age, and that increases to 40% in people over 80 years old. So often it's related to impacts of medication, but there's also a combination of factors that can relate to medication and other conditions like diabetes, Alzheimer's, Parkinson's disease. So as I say, it's found to be twice as likely that somebody will be on drugs that will cause side effects of dry mouth as they get older. So as I say, it's one of those things that, you know, if you take 4 or more daily prescription drugs, the chances are you are going to suffer from a dry mouth. Sjogren's, autoimmune conditions, Sjogren's is the second most common autoimmune connective tissue disease, and is the symptom that is most frequently associated with saliva dysfunction and dry mouth. So 90% of those people with Sjogren's tend to be have other symptoms such as joint pain, tiredness, fatigue. So I say there's a lot of things that come into that. So if you're having chronic dry mouth and your eyes are dry and you maybe have some of the other symptoms, maybe joint pains, dry mouth, dry eyes, have a chat with your doctor, because they may well refer you on to actually find out, you know, have you got Sjogren's syndrome, and then at least you're going to be managing if you have other conditions that actually relate to that. Other conditions that you may not be as familiar with that can be associated with dry mouth are things like cystic fibrosis, graft versus host disease, hepatitis C virus infection, HIV and AIDS, hormonal changes, both pregnancy and menopause, lymphoma, nerve damage relating to your head and neck, maybe through injury, poorly controlled diabetes. There can be a number of psychogenic causes, problems with actual gland, your salivary gland function and your salivary glands in themselves, stroke, and uncontrolled hypertension. So if you've got uncontrolled high blood pressure, again, this is also associated with a dry mouth. So it's always worth, if you've got a dry mouth and you're not sure, just stop and think, what am I taking, what am I doing, what can be actually related to this. Lifestyle things, as I've already mentioned, alcohol, tobacco, and excess caffeine, and or spicy foods. You know, if you like your spicy foods, it can dry you up. So what do you actually notice with your dry mouth? So what, I'm going to just turn this over one wee second, because I don't really want you to go on to that just yet. As I say, this is why, do you remember the good old days when we used to have blackboards and things like that? You know, we used to be able to draw on those. So, signs and symptoms, a sticky, let me just set that over to one side, just a minute. So, signs and symptoms, what might you be experiencing? Well, you might have a sticky, dry or burning sensation in your mouth. You might have trouble chewing or swallowing, or your food doesn't taste the same, or you might have problems speaking or talking to people. You can't tolerate spicy or salty foods or sour drinks. That might have changed for you. You might have a very dry, sore, hoarse type throat. You might find that your lips are very dry and cracked and peeling, and I mean that can just be plain miserable, particularly if they split and they start to bleed. Your tongue might be very pebbled, so it might look as if it's got little bumps all over it. It might be very fissured. It can be quite rough sensation, so some people say it's like a dry flip-flop, you know, but yeah, that's not actually a bad description of it. And I have seen some very, very sore looking tongues just purely through poor saliva flow. The saliva itself might look very frothy, so if you actually look inside your mouth, you see this sort of frothy, stringy, ropey saliva. It makes it very sticky and just hangs around your mouth instead of flushing and washing stuff away. You might end up with some ulcers and sores in your mouth. You might have sort of oral thrush, something like that. Your voice might get a bit hoarse. You might be worried about bad breath, and struggle to actually wear dentures or some other sort of prosthesis that you would ordinarily wear without any problems. So all those things are contributing, that are actually things that you may notice. Ultimately, when you are treating, let me bring my little board back again. There we go. Have we got it? Yes, we've gone back again. So ultimately, when the aim of actually managing or treating a dry mouth is very much the first place you go to is working out what's causing this. And those of you who know me know that I am a big who, what, where, when, why, and how person. And I like to always know, why am I seeing what I am seeing at this time? Or why are we experiencing what we are at this time? So it's always important to try and identify the possible causes of your dryness. You know, then what you want to do is try and relieve any discomfort or pain or just general miserable unpleasantness, and try and prevent complications. So from an oral health point of view, we're very much talking about preventing things like tooth decay and gum disease, or periodontal infections, or some sort of candida or thrush infection. So various ways you can go around checking out how dry your mouth is. You know, do you always need to eat with a glass of water or something to make it easy for you to swallow? Do you struggle to sleep through the night for your mouth being dry? Are you taking medications that are contributing to it? Are you not drinking enough water? First of all, I would always suggest the first stop is drink more water. Sip water throughout the day. So, oh, you can't actually see that. There we go. Sip water. You can chew sugar-free chewing gum, because chewing, the actual action of chewing, stimulates the saliva flow. Sucking on ice chips, that can be quite useful and give a lot of relief, particularly if your tongue, or if you've got a burning tongue sensation, or your mouth feels as if it's really quite sore. That can give you quite a lot of relief. Use a good lip lubricant. So the best one that I have come across, and of course I did not bring it up here this evening because I went to the warehouse earlier on and I wandered around and I gathered a whole lot of products up, and I forgot to bring up the dry lip balm. But Oraleave do a really, really nice dry lip balm, and it really works, and it is worth actually having a look at, because a little of it goes a long way, as I'm a real fan of that, because it is awful, particularly if you're getting cracks at the corners of your lips there. It's really, really unpleasant. So something like that. Avoid things that are actually exacerbating it. That makes sense. We're not always very good at that, are we? Actually avoiding the things we like. But switching from caffeinated coffee to decaffeinated coffee or tea, that's something relatively simple. Try avoiding the spicy foods for a few days and see if it actually makes it better. And that might be a payoff worth making, you know, a trade worth making for the comfort that you're going to get from actually cutting those things out, and then sort of saving them, that you know you're going to have it as a treat and you know you're going to suffer the consequences of it. Certainly avoid sugary snacks, sticky snacks, because anything that's sugary and sticky in a dry mouth is going to stick a heck of a lot longer than it would otherwise, because you don't have that lubrication, that saliva that flushes and buffers and neutralizes and rinses away the things in your mouth. I mean, saliva has huge self-cleansing properties, so it's a key part of our self-cleansing mechanism in our mouth. So our ability to go like and poke food around from our mouth and clear our mouth, and the calcium and phosphates in the saliva that remineralize the tooth surface by buffering and neutralizing those acids and maintaining our mouths at a healthy pH. So it's not too acidic, it's not too alkaline, it's just perfect, and it helps to buffer and neutralize acids and replace the calcium phosphate that is lost through demineralization after an acid or sugar attack on our tooth surfaces. I say avoiding the irritants, alcohol, caffeine, tobacco. Use fluids. Use water. Get yourself a nice water bowl, get some ice cubes, treat yourself, and keep it cold. I personally prefer ice cold water. I will drink warm water if that's all that's there, but I'm not a fan. And some people will actually find that using a humidifier at night actually can just maintain their hydration levels. Certainly there's lots of products out there that can help. So let's think. You have actually identified why your mouth is dry. You have worked out what is causing it, and you are now looking for products that are going to help you manage the condition. There are an awful lot out there, and what I will say is there is not one size fits all with these. You've got to look at your risk versus your what you can do to actually maintain that. So some of you will have seen my fairly favourite well, I was doing really well until I dropped it all, but some of you will know about my favourite prop, which has not been out much recently actually, but this is my favourite prop. This is my bounce. Well, these are my bouncing scales. And what I like to say is, if your mouth is dry, you have increased your risk of problems in your mouth. And what you need to do is counteract those risks by increasing the protective factors on the other side to maintain this balance between those things that are going to increase your risk of problems, so tooth decay, gum disease, bad breath, oral infections, ulcerations, and things that are actually going to counteract that and actually help maintain a healthy mouth. So what are those things? What can you actually do? Well, number one, you can ace your oral hygiene. And a clean mouth will reduce the damage that can be done by bad bacteria, whether it be bad bacteria that are going to cause tooth decay or bad bacteria that are going to cause gum disease. But maintaining really good oral care routine every single day is paramount to managing the consequences of a dry mouth. So what you want to do is make sure you are brushing thoroughly, gently but thoroughly, last thing at night and one other time in the day. Now, don't get too bogged down whether it's before breakfast or after breakfast. Your dental team may give you very specific advice on that, and that is fine, you follow that. If you're not sure and you want to talk about it, give me a shout and we will have a chat. But what you want to do is try and make sure that you're using a soft toothbrush, electric or manual. If you've always used an electric toothbrush, I would not change it. Soft head and a fluoride toothpaste. Now what may happen is your dentist may increase the level of fluoride in your toothpaste, so they may actually give you a prescription toothpaste. So that might be one that has 2,800 parts per million of fluoride in it, or even 5,000 parts per million of fluoride in it. And those are prescription only, so your dentist will have to give you a prescription to get those. Now, with any fluoride toothpaste, if you've got a dry mouth, you want to be using at the higher end of fluoride toothpaste. So that is something that is 1,450 parts per million. And with xylitol, if you can get the combination. So with xylitol stops the bacteria that cause decay sticking to your teeth. Now, really important when you brush your teeth to spit the toothpaste out, but don't rinse out afterwards. Let the toothpaste stay around your teeth. Get the maximum benefit from what was in the tube. Make sure you're cleaning in between your teeth every single day. Now, you may find because your mouth is so dry that the plaque biofilm is building up faster and you're getting food sticking more often, and you may feel that you want to clean in between your teeth twice a day. Always do it before you brush or at a completely different time in the day, because again, if you have got another condition like Parkinson's or an autoimmune disorder and you are suffering from fatigue or you have cancer, it may just be an effort to get it done once in the day, but try and do it at least once in the day. I say before you brush, let the toothpaste then be the last thing that stays on your teeth. So the fluoride is actually working for you while you're sleeping or while you're going about the rest of your day. So making sure you're really, really particular about your oral hygiene is really important. Clean between your teeth. Now again, you may find that your usual interdental brush is too uncomfortable. It might be uncomfortable, it might feel quite stiff. There are extra soft interdental brushes. Now the Curaprox bristles generally are quite soft anyway, but TP actually do an extra soft range that an awful lot of people don't actually know about, but the bristles are considerably softer. And it does actually make quite a lot of difference if your mouth is sore and your gum tissue is quite tender, of switching to those. But again, like I'm always saying, size really matters, so you want to use the biggest one that will fit comfortably. And if you're not sure which one's the one that's right for you, get a multi-pack. Buy a multi-pack of these things, because you get one of different sizes and then you can try it out and you go, oh right, well that fits there, so I'll start with the biggest one, and then oh, it'll not fit there, I'll go down a size. So my rule of thumb is get a multi-pack, start with the blue one and see where the blue one will go, and then go up or down either way. Don't ask me why I always go with the blue first, but my good friend and partner in crime clinically, Hazel, would tell you always go with the blue and then we'll go up and down from there. But use the extra soft brushes, because that might be much more comfortable, and something is better than nothing. You may also find that a water flosser is perfect for you because it has water and because it stops feeling anything more dry. It's quite comfortable to use. But again, use it effectively. Don't just fly around with a water flosser. Now, I just happen to have this one here, but there are, I mean, there's the Fusion water flosser toothbrush. I just love it at the minute because you can actually brush with it and you can use it as a water flosser at the same time. And what I've been doing with that is not using any toothpaste at all, and then actually putting some tooth mousse, which is remineralizing cream, on my teeth afterwards. But a water flosser may well actually work nicely for you if your mouth is very dry, because it has that sort of flushing action and it's just comfortable. And I mean, if it's comfortable, you're more likely to use it. You're more likely to use it. You're more likely to gain the benefit from it. Make sure you're visiting your dental team regularly. Really, really important. Some people sort of think, well, I'm not having a problem, so I don't need to see them. Your dental care team are there to help you, and they're there to actually support what you're doing every day. Now, if your mouth has become very dry, what happens is that counterbalance, do you remember what I was saying about, I'm trying to go this way, the right way on the screen, the counterbalance to your mouth becoming dry and your risk increasing of tooth decay and gum disease is the fact that your dental team may need to do more. They may need to do more frequently, and they may need to offer you other things like topical fluoride varnish or fluoride mousse gel treatments, and just maybe using different techniques just to help control the plaque biofilm and the tartar, which will develop more rapidly if plaque will be more tenacious if you have got a very dry mouth. So it's worth thinking, how often do I see my dental team? And I know at the minute routine dentistry is varying right across the UK and across the world, but certainly ring up and have a chat with them. And I say, if you're not sure, give them a call. We've got a live chat function on the website for a reason. A lot of the time I am here. If I'm not here, somebody else will reply to you and say, well, listen, it's a question I don't know the answer to. I will get Leigh to drop you an email, and then we will set up a chat, or we can just email back and forth, whatever works for you. Dentures and appliances often get forgotten about in a dry mouth scenario unless you're having problems. Saliva has a real impact on actually how stuff adheres to and sticks to your dentures. So keeping dentures, or if you're wearing retainers or a clench inhibitor or whatever other thing you're putting in your mouth, it's really important you keep it meticulously clean. Now, that involves taking it out and brushing it. It is not good enough just to stick it in a cup with a tablet and think that's going to do the job. What that does, that effervescence will loosen stuff, but physically you need to physically use a brush and clean that brush. Now, you can use soap and water. Liquid soap and a nail brush work perfectly well. There are various types of denture brush there. The key is getting into all the little nooks and crannies in the denture, because whether it's a full denture or whether you're having orthodontic treatment or it's a little tiny denture like this, these have got lots of little nooks and crannies and they need to be kept really clean. You clean them and then you soak them in a tablet, and again there's guidance. We've got advice on the management of these on the website on the tips page to actually then let it disinfect. It also gives your mouth a rest when you take your dentures out at night. Really, really important. Take your dentures out at night. Clean the roof of your mouth underneath it. So, use your toothbrush, sweep it across the soft tissue. Keep that surface clean. If you're not sure what you want to use, now my favourite, and Mr. Cureprox has given me some stick about this recently because I got really excited when I came across this product. This is Cureprox's Daily Appliance Cleaning Gel, and it's lovely to use on appliances of all sorts, and it does a really nice job of cleaning them and making them nice and fresh smelling as well. This is their weekly appliance bath, and you just put a drop of that in water and let the appliance soak for a couple of hours. And again, a couple of really nice products from them. So I say those are my sort of go-to, but you don't need those. I mean, liquid soap and water is absolutely fine. Use a nail brush. I mean, that was what we were recommending for donkey's years for cleaning dentures, and it did the job perfectly well. So the important thing is physically removing that plaque biofilm. Right, chewing, consider using a SLS-free toothpaste. Now, SLS is sodium lauryl sulfate. It's a very common foaming agent used in a wide variety of products, not just in your mouths, but soaps and all sorts of things. And it loosens, it has a mechanical sort of loosening action, isn't it? But sodium lauryl sulfate can also be very irritating. So if somebody comes along and says to me, I've got ulcers and I don't know why, and they're really uncomfortable and they keep coming back and they're really horrible and I can't eat, the first thing I ask is, what kind of toothpaste are you using? And we look and see, is there sodium lauryl sulfate in it? And if there's sodium lauryl sulfate in it, so SLS in it, I will suggest switching for a couple of weeks. Sometimes I'll send them a sample to try it for something I know that's SLS free. And again, you don't necessarily need something specialised. You just need to know where to see it on the ingredients label. So a lot of the Sensodyne toothpaste are sodium lauryl sulfate free. Colgate have now produced a sodium lauryl sulfate free pro-sensitive toothpaste. Don't quote me on that, but I'm nearly sure it's a pro-sensitive. No doubt somebody from Colgate will correct me. But there's a lot of brands. Oranurse is the non-flavoured, non-foaming toothpaste, which tends to be the ones that's autistic friendly. It has got everything you need, it nothing you don't want in it. So it's got 1450 parts per million fluoride. It has no sodium lauryl sulfate in it. It is non-foaming. It has no flavour in it, and it is very, very user friendly for anybody with a sore mouth. There's also products, specifically toothpaste for dry mouth. So you've got the likes of the Biotine, you've got the likes of Oraleve, which again do a really nice range, not only in toothpaste but in gels, and they do a spray. So there's lots of things that you can use to keep your mouth clean that have the best ingredients without the ingredients that are going to irritate your mouth. Because often people have dry mouth, they have a burning sensation, they have ulcers, and I say it's sort of like a dolly mixture, which is a really bad pun talking about teeth, isn't it? Of things that actually aggravate their condition. Chewing sugar-free chewing gum or sucking sugar-free sweets. Now, there are a huge range of these. Now, we would generally recommend looking for something that has xylitol in it. So, as I said right at the outset, chewing is one of the mechanisms that stimulates saliva flow. So, chewing and sucking anything, you know yourself, if you've got something in your mouth that stimulates your saliva flow and sort of the taste and smell thing. But chewing sugar-free gum is great if you're a gum chewer. Now, I'm not a gum chewer. I do sometimes, as much to remind myself what other people use it for, but you're looking for a sugar-free chewing gum that has xylitol in it, preferably. Now, xylitol is clever. Armadi makes xylitol. Xylitol is produced mainly from the birch tree. So it's a natural ingredient, and what xylitol does is xylitol stops the bacteria that cause tooth decay sticking to your teeth. So it's pretty clever stuff. So we quite like that. And what happens then with xylitol, if you incorporate xylitol into a product, you're not only getting that buffering capacity, you're also getting that gain from the, hold on one second, sorry, from, oops, sorry, I don't know what I'm doing here. You're also getting the gain from the xylitol as well. So again, load of products like that. So Peppersmith do a sugar-free chewing gum. Again, this again, specialist one, although Peppersmith now available in many supermarkets. The one that most people are familiar with will be the Wrigley's. And Wrigley's, what you want to do is look for the little tooth in the corner. There's a tiny tooth in the corner. And some people ask me, why is there a tooth in that corner? It's because there's xylitol in it. Now, the difference between that and that is there's about 15 or 20% xylitol in your Wrigley's. There's 100% xylitol in your Peppersmith. As there also is in... let me see what to do with my choosies. I threw them on the floor when I dropped everything. So you've got the Choosies chewing gum, and if you are conscious about your plastic use, this is a great product because this is actually plastic-free chewing gum. And I did not even know that there was plastic in chewing gum until I came across Choosy. Choosies also come in quirky flavours from the point of view of chewing gum. So there's cinnamon and there's lemon. as well as a spearmint and a peppermint. So they've got quite a lot of options there. Peppersmiths do both mints and chewing gum. Again, lemon, spearmint, peppermint. So you have options there. Then you have the likes of Dr. Hef's mints, which have both xylitol and green tea in them. Now, these are relatively new, designed and developed by dentists in the UK. Worth having a look at on the website. And these are the new packaging, and they call them Dr. Hef's Remarkable Mints, and they are actually pretty remarkable. So lots of options there. You then have the likes of Xerostomp pastils, which have the benefit of something that's actually there for your dry mouth to actually lubricate, as well as ingredients that are actually going to help buffer and neutralize acids. So there's lots of options as far as chewing and sucking things that are going to do you some good. Something that gets used very widely are moisturizing products. And moisturizing products are brilliant, but I often find people are not maximizing the potential of them. So they're not actually, they just put them in their mouths. And I was as guilty when I first came across them. I don't think I recommended their use desperately effectively. They are best massaged in. So if you think about you putting moisturizer in your face or some cream on, it's best when it's massaged in and then it's rubbed in. Likewise, moisturizing gel. So you can put it on a clean finger, just rub it well in. Or you can use something like my go-to for getting any moisturising gel in the mouth are the wee 360 brushes again from Oraleave, and these are just super for actually massaging in over the tongue. You put a blob of gel on that and really rub it in. The other one that again, you don't need to be buying anything specialised. Get yourself some olive oil, go to the kitchen, find some olive oil, a teaspoonful of olive oil, massage that in. Some people find that is absolutely great. Likewise with there's sprays, specialist sprays, great for carrying in your bag. But you know something, you can buy a little bottle, a spray bottle in the chemist and use it. Just spray water, just fill it with water and keep it in your bag, and that can make a huge difference if you're out and about. Something I didn't mention with oral hygiene was making sure you're cleaning your tongue. Now clean your tongue from the back forwards, particularly if you're finding you're getting a lot of a coating building up in your tongue. So use this is one tongue scraper, there's lots of them around. An inverted teaspoon will also do the job pretty well, but use it from the back forward, and you can see there's little ledges, little ridges in that. So you don't want to be scrubbing up and down, but you want to come from the back forward so that you're actually scraping the stuff off. Do it gently, because otherwise you will actually traumatize. It's like anything in your mouth. If your mouth is dry, like your skin is dry, you know, if you've got dry skin, it cracks and it breaks. The inside of your mouth is exactly the same. So moisture is the key. You feed the moisture from internally by drinking plenty of water and retaining your hydration levels, as well as actually topically putting products on that are going to actually maintain that moisture and keep the moisture that you have there in the right place for the right length of time. So moisturizing gels, again, lots of them. I mean, that's the Oraleave gel. Biotin do a gel. I lifted the toothpaste. Yeah, that's the toothpaste. That's the gel. So there's a Biotin gel. Some products are available on prescription, so it is worth asking your doctor and or your dentist about what is available on prescription, if that's an option for you. But otherwise, there are lots of moisturizing gels. My father had a severe dry mouth in his last lot of months of life, and we fired everything at him, if the truth were told. Now his go-to product, one he liked best, was the GC dry mouth gel. Now GC not only make dry mouth gel, but they also do remineralizing products. So you know, they're a manufacturer, a company that actually produces a lot of dental materials, and so they're very familiar with what goes on in the mouth. But the dry mouth gel, the GC do, it comes in quirky flavours, so you get lemon and orange and different flavours in it. All of them tend to be quite mild flavouring anyway, so the Oraleave is also another one of my firm favourites. Infection wise, using a moisturising mouth rinse can also help. using something like a fluoride mouth rinse, make sure any mouth rinse you're using is alcohol free. That is really important, because otherwise you sort of send the balance the wrong way, because alcohol is the drying effect. So using something that's alcohol free, free fluoride mouth rinse. If you're increased risk of tooth decay, again, use it at a different time of the day, can help to counteract that balance and remineralize the tooth surfaces. Now, if you remember what I said earlier on about as we get older, we are increased risk of dry mouth. Well, often we're also a generation who have a lot of fillings, who may have quite a lot of recession, so our root surfaces are exposed, and root surfaces of our teeth are much more likely to decay than the crown of the tooth, because they're much softer. So when the pH drops, when we don't have that saliva buffering and neutralizing and putting calcium phosphate back in our mouths at the rate it would have done, your pH does not have to fall as low as it does to cause tooth decay of the enamel and the crown of the teeth, to cause tooth decay on the root surfaces. So root surface decay can be a major issue, for particularly for older people. And we talk about radiation decay after somebody's had radiotherapy. So there's a lot of things that can make these things worse. So what you want to do then is make sure you're being meticulous, all the things I've just said, and then using products that remineralize and harden the tooth surfaces and actually help protect. So the likes of the Dr. Hessmint's, the xylitol, things like that, but also extra levels of remineralizing. So something like tooth mousse or MIPS Plus. Now, MIPS Plus is basically toothpaste plus tooth mousse plus fluoride. That's not easy to say. And the MIPS Plus is in the ratio, I think, I'm trying to think what it's called in the States. Tooth mousse Plus, I think it's called in the US. It's not exactly the same product, just slightly different term labeling on it. But Tooth Mousse Plus, or MIPS Plus, has calcium phosphate and fluoride in a ratio of 5:3:1, which, if we could build the strongest tooth possible, that is the ratio of the calcium phosphate and fluoride that we would have in the tooth. So it is really easy again to use. Blob on the finger, rub it around the tooth surfaces, because it's the tooth surfaces, the hard surfaces, that you want to remineralize and you want to protect from tooth decay, from acid erosion, from wear. And that actually then can be used in conjunction with your dry mouth products. And again, if you're not sure what to use and when, because often I get people coming through to me and they say, you know, I've been advised to use this and I've been advised to use that, and I don't know when to use what, where, when and why. And often it's just working on a regime, a routine that's going to work for you. So you do X now, you do Y then, and you do Z at the other. And then actually working that you're not going to be counteracting what you're doing with one by using another. And that is really important. And I am really sorry, because I have just... Oh, right. Thank you, Valerie. Oh, Valerie, I'm sorry, I hadn't realised that you were there. Humblest apologies. Yes, size does matter, Valerie. And I know you're our biggest fan of interdental brushes and how important size is. Olive oil is a great one for that. So apologies, I had not noticed that. So, right. Anyway, lots and lots of remineralising potential there. Fluoride is obviously the first one. So make sure you've got good fluoride in your toothpaste. And just a little word of caution with fluoride in own brand toothpaste. I don't know where own brand toothpastes are made. I don't know who makes them, and I cannot stand over the fact that the fluoride in those pastes becomes bioavailable in the mouth. Now, what I mean by bioavailable, so I don't know that it's actually able to separate and be taken up by the tooth surface to do what we want it to do. Whereas I know from the big brands that work with the professions that have created fluoride toothpaste to support dentistry and oral health, they have done the research, they have proven their evidence that actually we do actually get the fluoride onto the tooth surfaces. So stick to the brands that you recognise. There's lots of them out there. We have some quite specialised toothpaste on the website, but you know something, there's plenty of really good over-the-counter toothpaste that you will recognise the names. What you're looking for is the fluoride that is in them, and you're looking for something with at least 1350 ppm of fluoride in them. And if you're not sure where to find it, It is an incy wincy writing here, and I can't even see that with my glasses on. I am the one that would have a magnifying glass there, but it will say sodium sodium fluoride or sodium monofluorophosphate or something to that end, and it will say the number on it. Now, there is always one that doesn't actually apply, the rule that doesn't apply, and that is worth mentioning is BioClean. Now, Biomin, oh, put my teeth in. Biomin toothpaste is a relatively new toothpaste that's been manufactured and developed by Queen Mary's University in London and Imperial College. And Biomin uses a very low level of fluoride, which is released over a long period of time. So where it doesn't say 1350, which will confuse, it will actually give you a longer lasting amount of fluoride in your mouth over a longer period of time. So fluoride is slowly released through the use of a bioactive class, and it will be slowly released over about 8 to 12 hours. So it's another one worth thinking of. It's described as armour for teeth, and you don't have to just go for the minty adult dose. If you don't like mint, that you find mint irritates your soft tissues, your gums and your tongue, and you just cannot stand mint, they do 2 kids versions which have exactly the same ingredients. One's melon and one's strawberry, so it's worth remembering those. So lots of options there. So what have I not mentioned? I've mentioned mouth rinse, and again, use of denture adhesives can make a huge difference. So if you if you're struggling to keep your dentures in your mouth because your mouth is dry, get yourself a denture adhesive. And do I have them in my Blue Peter packaging, which I usually will have one sitting here, and of course I don't. Oh yes, there's one I did make earlier. There's Fixodent. Again, other brands are available, but that can make a big difference to the security and give you more confidence if you are finding you are struggling to get your denture to fit comfortably because your mouth is so dry. So I think I have oh gracious me, how dare I have just realised I did not mention my go-to dry mouth product. Oh gracious me, somebody batter me with a large toothbrush. Xylomelts. Xylomelts are xylitol in a disc, these are a bit quirky. I came across them many years ago in London at a dental conference, and I got very excited, and I thought, these seem too good to be true. They cannot be this good. And what you have is this little disc, and on one side there's little brown, this is the adhesive side, and then this is the side that releases xylitol, and you can put this up. I'm not going to actually stick it in, but you can put it on the soft tissue, and you just hold it there until it actually sticks. Take a few seconds to stick, and then you can just forget about it, because what happens over the next 8 to 12 hours is that actually releases xylitol, and it will keep them moist. Now, as I say, when I first came across them, when I first came across them, I thought, that'll never work. Never work at all. I have been so impressed with these that they actually do stay in your mouth. You can use one, you can use two, and I actually want to pick that out because I should have put it further back. But I'm just going to look at the model. I usually have a model here with one of those on. There you go. I usually suggest trying to get them as far back, sort of on over the outside of your roller here. You can actually stick them to the palate. And I have a couple of clients that use CPAP machines, so they have CPAP to help them breathe at night, and they have incredible problems with dry mouth, and they swear by these. And as I say, I have been very remiss that I didn't mention them earlier, because they are actually my go-to product if somebody is having severe dry mouth problems and wants relief over a long period of time. They come in two flavours, so you've got an unflavoured and you've got a mild mint. Both great options. Some people prefer the slightly sweet unflavoured to the mint. It's horses and horses. They also do a product called Renewing Melts, which is the same idea. It's an adhesive disc, pardon me, and what it has is hyaluronic acid. So any of you ladies who are very into your tightening your your facial tissues. You will know about your hyaluronic acid and hyaluronidase and how that actually helps and promotes healing. Well, the renewing melts, if you've got a sore mouth, burning mouth, something like that, the renewing melts are well worth a look, because, as I say, it can make such a difference to your quality of life. So, I love the fact that I went back to paper tonight, because after all my technical issues of the last few weeks, I just thought, to heck with this, I'm just going to print the slides out. It was way easier. And actually, do you know something? It's a sign of my age, because I'm much more comfortable with this sort of thing. I need a 10-year-old to help me with my tech stuff, but I just need the internet to improve here. But if you can hear the birds and you can hear the waves lapping there, you can tell, you know, sometimes I just have to cope with the internet problems. But anyway, if all else fails and you do not know what to do about your dry mouth, and it is worrying you and it is causing you distress, talk to us. We are actually here to help. The whole purpose of Growing Smiles is to help you help yourself, so that you need support from your dental team rather than being fixed all the time. So it's really important that what you try and do, you make the effort to do everything you can on a daily basis at home, so that you actually can then use your dental team to maintain your mouth and create an environment that's conducive to your health with the least amount of invasive treatment that is necessary, if that makes sense. So really, really important that you do what you can. Your dental team will then support you by doing the least invasive thing necessary to get you healthy and keep you healthy. Now, that might involve regular visits to the dental hygienist or the dental therapist, because what they will do is clean your teeth. They will remove the calcified deposits that you can't actually remove, and what that does is that allows you to keep the rest of the plaque under control much more easily. They'll also be able to monitor your gum health. They will make sure that your dental team will monitor all your oral health through your teeth, your gums. They will do oral cancer screenings. They will check to see that your fillings are intact, because again, as if you've got a lot of fillings as you get older, the margins of those fillings can break down. You can get secondary decay around the margins of old fillings, and those sorts of things can be exacerbated by dryness. So you may not find that you haven't needed a filling in 25 or 30 years, and all of a sudden you have tooth decay. And the first thing you always want to look for is what has changed. Why have you got a new cavity now? And that's where we come in. Our whole philosophy is trying to work out why you have a problem with your mouth, with your oral health at this time. And we support dental practices, dental professionals, as well as members of the public. We just do good old-fashioned oral health promotion a slightly different way. So we are ultimately here to help. And any of you that have either used the live chat function, dropped us an email, listened to Talking Teeth Thursday, message me on Facebook, whatever social media platform is your preference, you will know that ultimately if we can do something to help, we will. That's what it's all about. The products that we stock on the online shop have been they've been very carefully selected. If we cannot stand over that they have a genuine benefit, you will not find them there. So as I say, if you find something on the website you're not sure how to use it, or is this best for you, give us a wee shout, ask me and or one of the team, and we will do our utmost to help you. If you just want to find out a little bit more about your oral health and what you can do to help yourself or help your family member, you maybe are caring for somebody, you're worried about your kids' teeth or whatever, why not book time out for teeth? The whole concept is oral health coaching, and that is what we're here to do. We're here to help you help yourself and be the best, most effective oral health care person that you can be, so that your smile exactly what you want to be. And even if you can't see your dental team at the minute, you can make sure that you are doing everything in your own power on a day-to-day basis to get your mouth as healthy as you can and keep it as healthy as you can. And what you'll find is actually when you do get back to the dentist, you will not need as much treatment. That they will be very impressed with your efforts, and that you will actually have maintained the status quo, which is really what you want, is just to maintain that balance. Because I love my balancing scales just so much, it is all about getting the balance right in your mouth. and working out where your tipping point is. So your tipping point for disease may have been the dry mouth. That might have been your tipping point. It might have been that lockdown, you have been eating 2 bags of jelly babies every night. Or it might have been you haven't bothered brushing your teeth before you go to bed at night. Or you've given up on the interdental cleaning. Whatever that tipping point is tip the balance between health and disease in your mouth. We can help you identify it, and we can help you actually change things around a bit and up your game, so that you're actually doing everything you can to avoid invasive dental treatment, because I have yet to find anybody who actually likes putting their rear end in my chair. So there you go. Here we go, there we go. We have been here over an hour. Oh my goodness me, how time flies when you're enjoying yourself. Bit about dry mouth. Hope you find it interesting. Thank you ever so much for joining me. We are well over our 4th year birthday for Talking Teeth Thursday, and we are still going strong. So you don't be surprised to hear I will be here, same place, same time, next Thursday at 7, and I've got another guest coming up in a couple of weeks' time, which will be really interesting. So any of you that know anybody in education, whether it be a board of governors, teacher, principal, anybody in education, you want to make sure that they listen in when Jo Dawson joins me for Talking Teeth Thursday in a couple of weeks' time, because Jo is going to tell us a lot about her campaign about dry raisins and dried fruit in schools. So don't miss that. I will be putting a little bit more promotional stuff on the website and on social media platforms in the next week or so. So until then, I hope you've got sunshine where you are. We have sunshine where we are, which is amazing. And I am going to go and make the most of it. I am first of all going to have a very large drink of my water, because I am absolutely parched with all that talking. And that's me, and I don't actually have a dry mouth normally. So there you go. Listen, look after yourselves. From your best buddy, brushing buddy, I will see you next week. Take care. Thanks ever so much for joining me. Feel free to share, leave comments, follow, do whatever. We always appreciate your support. So thanks again. See you next week. Thanks, folks. Bye.